Not sure if you should turn to the healthcare system for mental health? Do you have anxiety? By the end of this video, I will break down the whole mental health care system's process. I will also break down Bmike's song Anxiety and its relevancy to real-world situations and actual anxiety itself. For the rawest and unmatched truth about mental illnesses, the mental health care system, and the problems and solutions that mental illness patients face, subscribe to my channel and hit the notification bell so you will be notified every time a video drops every Saturday. As a mental health patient, I've seen several psychiatrists, several therapists, been in several programs, and been in and out of full and partial hospitalization. My career is healthcare. I work in the corporate revenue cycle in the financial department of healthcare. Since I've worked in the financial department of healthcare, I've gained a different perspective of patient care and billing. Now I'm going to let you in on the process as a patient and also on the other end as a provider in the healthcare billing process. First, we're going to talk about the breakdown. So first you will go to your primary care physician. This is the doctor that you go to for colds and flus. Now, if you go to this primary care physician, you will have to tell them about your symptoms. You will have to let them know what's going on with you. If they feel like there's something that they can treat as a primary care physician, they will treat you. However, if they feel like your case is severe enough or it's outside of their scope, they will send you to a psychiatrist with a referral. Once you get that referral, you will go to a psychiatrist. Depending on the practice, the psychiatrist may require for you to talk to their therapist. So you will talk to the therapist and then you will talk to the psychiatrist. The psychiatrist will then prescribe you drugs, and then you will have to come back to the psychiatrist in order to get another prescription, more drugs to see how you are, and then they might even require you to also get more therapy help in conjunction with the drugs. As a patient, you may have to pay several copays and meet your deductible and your out-of-pocket from going to these different therapists and doctors' visit. On the doctor's side, the copays will pay for the doctor's time. Your time with the doctor and a therapist really depends on your insurance and how much they will pay for you to be seen. When it comes to your treatment, your insurance has a lot to do with the type of treatment you will be able to take. If you are self-pay and you do not have insurance, I do understand that this is very difficult to see a psychiatrist or to even get any type of medicines because of the different visits to the different types of providers that you will have to see just to get one type of medication. So let's just do a little scenario really fast. So say for instance, you have anxiety. You will go to your primary care physician, which may be, and we're just throwing out numbers here, but you go to a primary care physician, which may be about $100 for you to be seen without insurance, maybe a $25 copay with insurance. Once you pay that $25 copay with insurance, your doctor will send you to a psychiatrist. The psychiatrist may charge, they are considered a specialist, so the charges are usually higher. They may charge $50 to $75 for a specialist with insurance. $200, around $200 without insurance. So then you pay that on top of the primary care physician's bill. Then once you go to them, if they require you to go and see a therapist, you also have to pay the copay for the therapist, which I have, in my experience, has ran about $100 an hour. In Bmike's video, he started off initially talking to the psychiatrist. I assumed that was a psychiatrist, and telling her that he did not want to talk to her. He was just coming to get his drugs. That's all he wanted. She told him that I can't do that, and the psychiatrist cannot, by system, just give drugs out. They have to talk to the patient and find out the best drug to give the patient, as well as know the patient's background. So the video implicates that they had a therapy session for an hour before she could prescribe him any drugs. He had to basically pour his heart out, and she would prescribe him what she thought could help him with his situation. I will note that in Bmike's song, he referenced that the therapist really did not care about what he had to say or his problems, that she just wanted to eat up an hour or the time it took to talk to him just so she can get another paycheck and take her kids out on another vacation, where it was basically about monetization versus actually caring for the patient as if they cared. The signs of anxiety. In Bmike's song, he referenced unwanted thoughts, feeling of doom, and lack of control. Those aren't the only signs and symptoms of anxiety. Those are just the ones he referenced. So what are your thoughts on the mental health care system? Do you feel his pain? Do you agree with him? Let me know in the comments below. Don't be afraid to put your answer. We all have different aspects, and we all have had different experiences. Other symptoms can be insomnia, spacing out, fatigue, palpitations, trembling, and so much more. It really just depends on the person that's affected by the anxiety. It doesn't all come out the same way. My list can go on and on. Do you have some of the symptoms that I just mentioned? If so, would you like to join a community with like-minded individuals who do not judge, who understands where you're coming from, and can help encourage you along the way and maybe find some solutions and to just be with you? If so, join my closed Facebook group, Speakslyfe. Please like and subscribe to my channel for more in-depth content on mental health. For a more in-depth, acted out version of anxiety, check out this video of anxiety. See you in the next video.